Do you guys understand that health insurance is not actually healthcare? Health insurance isn't healthcare. We shouldn't allow United Healthcare to be called United Healthcare. Insurance companies, the insurance industrial complex, is not healthcare. They're not in the business of healthcare. Like, let's get that squared away, okay? Doctors, hospitals, they're in the business of healthcare. Some pharmaceutical companies also in the business of healthcare, although they often spiral out of control. But I'm sure at some base level, the people that get into it and are trying to formulate medications to help ease the symptoms or cure certain conditions mean well at first until money gets... Anyways, that's a whole other video, the pharmaceutical company. But we need to stop thinking that affordable healthcare can only come from our government paying a company that has nothing to do with healthcare an ungodly sum of money, while they also additionally charge us a lot of money to what? What do we need them for? They've convinced us that we need health insurance in order to keep our healthcare costs low. And yet we see time and time again that cash pay discount often winds up being cheaper than out of pocket with insurance, while also additionally having to pay hundreds of dollars a month. Like, make it make sense. For those of you death gripping this fucking system, please use your brain. Look around. It doesn't make sense. And we say, oh, well, like the major things. Okay, then let's figure out a situation for being able to afford the major, cancer treatments, chronic health conditions. I get it. But we don't need health insurance for standard shit. There's a video going around today, a doctor calling just for pricing, MRIs, x-rays. Like an x-ray is like $50 if you pay for it out of pocket, like cash pay. MRIs are like $300. Like, with insurance, you're going to pay more than that out of pocket. It doesn't, like, it literally doesn't make sense for us to be death gripping this fucking situation, this system. Health insurance is in the business of taking your money and keeping your money. United Healthcare apparently is using AI to deny claims. Doctors are spending more money on staffing to try to get the money from the health insurance companies than they're actually getting in some cases. When I was looking for mental health ongoing, there are quite a few mental health provider doctors in my area that just straight up won't deal with Blue Cross Blue Shield because they're not getting paid from them. So I am paying Blue Cross Blue Shield X amount of money a month, and I can't use it because they're not paying out doctors that provide mental health care. That is my story. That is what has happened to me. That is not okay. I posted a video about why we should not pay the Affordable Health Care Act subsidies. And everyone fucking lost their minds. It's because you're not understanding. You're not understanding that health insurance isn't healthcare. And it sure shit isn't making it more affordable. Oh, well, you should have been buying insurance, before that was wrong too. But then they fixed it by fucking it up even more. This isn't better. Yes, some of the rules are, absolutely. But the fact that it becomes impossible before the Affordable Care Act to obtain medical care if you have a pre-existing condition, that should not have been legal, period. They should have just, that's illegal, we're not doing that. But also, so is charging a family $2,300 a month for health, illegal. You guys are criminals. That's fucking corporate gangster right there. Health insurance is not healthcare. The fact that they deny what doctors say they need to diagnose and treat when they have no medical degrees, none. The fact that they deny patients certain medications for God knows what reason, when the doctors are saying, I, with my medical degree, having had this personal relationship with this patient and prescribing this, why are you guys denying it? Because they're in the business of taking your money and fucking keeping it. So I just, again, want to be very clear. When I say we don't need to be paying these crazy fucking subsidies, what I mean is that we don't need insurance, period. This would be money better spent on just establishing a nationalized healthcare system. And potentially we could allow certain companies to operate independently for those that have extra money to buy more expensive healthcare if that is their desire. We could do that. We could allow that. And for those of you that think that waiting rooms are going to be hours and hours and hours of waiting, that's what they want you to believe. If done correctly, if staffed adequately, that doesn't have to be true. My dad lives in Thailand. That is not the case there. So that's not something that has to be true. Okay? One last time. Health insurance is not healthcare. There's nothing caring. There's no direct patient care with health insurance companies. We do not need them. And I cannot wait until the day that we no longer use them.